Okay, today we're going to talk a little bit about breast symmetry. What really should we talk about is breast asymmetry, because all breasts are different. I'd like to say they're sisters, not twins. And so when we look at someone's breasts, we know that they're going to be different. Most patients don't know this, they're unaware of this. And when I measure them and I say, well, you're 5 millimeters off here or a centimeter off here, they kind of freak out and like, oh my gosh, I never knew this. It's normal, it's absolutely normal. But what this means, when we look at your breasts, we feel them and we look at the volume of breast tissue. I also look at your hand dominance. Sometimes it's right, but sometimes it's left. And sometimes that muscle is so much bigger that that's going to come into play, that somebody just has a really dominant muscle. And sometimes the chest wall itself is slanted or crooked. And that's because some people have scoliosis. Some people, I joke, just have a big heart and their left side of the chest is just pushed out a little bit more. So there's so many things that we can look at and I measure and evaluate. And what that means is that I'm going to adjust things as I see fit to try to improve your symmetry. And that means that we sometimes don't use the same implant. Sometimes we use a 325 on one side and a 350 on the other side. Sometimes if we're using a saline implant, we'll have a fill of 350 on one and 365 on the other. And we'll manipulate those volumes and sometimes implants to help improve your symmetry. And I think that's really a key important thing, because some docs just say, hey, we're throwing in 350s and you get one on each side. And the problem with that is that breast augmentation will magnify a breast asymmetry. So I'd like to try to improve it from the start, not try to explain something later to a patient, we should have done this, we should have done that, because really you have one chance to do it right, so let's plan accordingly.